everybody. My name is Dr. Mandy, and I'm here with a very special guest. I'm here with Lisa Patel-Kila, and she is the founder of Vykon. So those of you who are my patients and are listening here, you know exactly what I'm talking about because all of you are taking Vykon, and it has been changing lives. And so I'm here to talk with her about the HTMA to help you understand why that's the first test that you're running with me when you sign up. And we're going to dive into what it means, what it's telling you, and more about Vykon. So hi, Lisa.
Hello, Dr. Mandy. Thank you so much, everyone, for A, joining us, and B, for allowing me to be here. I'm so excited.
So tell us a bit about your story and what got you into this field.
Oh my goodness. All right, I'll give you the condensed version. My entire life, I've always been passionate about health and wellness. I've always been at the gym. I was a competitive figure skater growing up, all the way into my 30s. And I was an entrepreneur. So I was in a highly stressed environment, and I'm constantly pushing myself as hard as I could go. And so went through many different stages of just pushing it a little too far. And so the last time that happened was the last brick and mortar business I built. And that was almost 2 decades ago. And so from that particular instant, I really wanted to dial in my health and figure out, how to fix this for good, because obviously it was something I was doing, but there was also a lot behind that too. And so functional medicine, right? I started studying, and many diagnostic tests, I peeled away so many layers of my GI dysbiosis, of my chronic fatigue, estrogen dominance. And so, years later, I found HTMA, which is hair tissue mineral analysis. And so it happened to be a colleague of mine, and I was getting a bit frustrated. When we're deep into health and wellness, and especially when we're practitioners or doctors and we're in this every day, we really want to hone in on our own health. So we're very committed. So when we're not getting to the bottom of something, that drives us crazy, right? And so I couldn't figure out why I was still having chronic fatigue and estrogen dominance. It was the last 2 lingering parts of everything that I had gone through. And so really what came to light was after I did my first HTMA test, it identified copper imbalance. So after talking with Dr. Malter about this, it was like an aha moment. The light bulb had come on, and I finally got the answer to the root cause. Now, is that always going to be the case? I don't know, but for me, it was. And so that's why I couldn't help but think after that happened, after that identification happened, and of course, then I fixed the imbalance, that I thought, oh my goodness, if I would have only found this test first, right? What would have changed? What would have been different? And so that was definitely a question that sat in my mind. And that's really why I came down this road, specifically studying minerals for years now, into relationships. We're in the middle of trialing with dogs, cats, horses. I just want everybody to know more. And I want mineral balance in general into the future to be even more advanced so that more people understand how powerful this really is.
That's a really good story. And we all have our story that starts off personal. So so now let's dive into that hair test, the hair tissue mineral analysis, which is what changed your life. And so we're going to talk a bit briefly about what it is and why everyone should do one.
Yeah. So first off, one of the best benefits for clients just in general is that it's non-invasive. It's super easy. We take a little hair sample, we send it off for testing. It's just a simple process. And the interesting part about it, though, is we're looking at the cellular function of the body. So it's deeper than blood work can show us, because blood always wants to be in homeostasis, right? And so if we can look at a bit of a deeper level, lower and kind of below what blood work's going to show us, we're going to be able to see things in advance of them showing up on blood work and potentially be proactive about solving some problems that may come. And so that's a really powerful part of that, especially when we talk about the significant ratios and what they tell us about the body.
So let's talk about the oxidation rates now, because we see, in my practice, I predominantly see slow oxidation, but every once in a while there's a fast, and then the mix. It rarely happens, but generally I see slow and then small percentage of fast. Let's discuss that a little bit.
Yeah, so when we talk about slow, fast, and medium, I'll kind of dive into it. I don't want to get too complicated, but I want people to kind of understand what they mean. And so the first part of this is related to one specific ratio, and that's the calcium to phosphorus level. And so the calcium phosphorus level, those two minerals, the way they interact with one another and the level that they should be, which is 2.6 to 1, what we want to see is we're seeing what the body's autonomic nervous system, where it's going. And so ultimately, the autonomic nervous system, think about being in the forest and you're being chased by a bear. What's going to happen? You're going to go into fight or flight. You're going to start running, right? And so that's called sympathetic dominance. Now, on the other end of the spectrum, after we have a big meal, maybe with our family celebrating a holiday of some sort, we want to take a nap on the couch. That's our rest and digest autonomic nervous system tapping in, which is parasympathetic. And so that ratio really tells us where the body is at. Are we in sympathetic dominance where the body's trying to run on fast forward, or are we really slowing down? Are things slowing down? And that has a lot to do with metabolism. And so interesting that you talked about the majority of your clients being slow oxidizers. That's the norm. So trace elements, out of the tens of thousands, maybe even the hundreds of thousands by now of tests that have been run there, 80% are slow oxidizers, right? And so then the next part of that, and this kind of gets into a little bit more of what the significant ratios, a couple more of them, is that there are two ratios that talk about and show us the functionality and then the effectiveness of the thyroid and the adrenals. And so when we have, for example, someone who is in that fast forward fight or flight sympathetic dominance, and we've got overactivity expression in the thyroid and the adrenals, then we have what we call fast oxidation, right? So everything's running on fast forward. It's running really fast, right? And then on the other end of the spectrum, if we have, right, that parasympathetic dominance where we're resting and digesting and our thyroid and adrenal expression is low or sluggish, then we have a slow oxidizer. And that's when everything's kind of slowing down. So we need to fuel the fire, right? And when we have mixed oxidation, really that can be someone who is in parasympathetic or sympathetic dominance, really doesn't matter one way or the other. But what it means is that we have, the thyroid is overactive with the adrenals underactive or vice versa. And so there's one gland basically that's overactive and the other one that's sluggish. And so that's kind of just a very simple breakdown of slow oxidation.
Where do we want to be? Like, is there like a place we want to be?
I get this question all the time. So in my mind, the commonsensical part of this is we want to have healthy adrenal function and thyroid function. Now, is that overactivity? Maybe slightly, right? Maybe slightly overactive. But if we're pretty close to balanced on either of them, I think that that's efficient, right? As long as the stress level is good. And in many cases, when we see these, because I have seen them before, your calcium to phosphorus, which identifies, again, that autonomic nervous system, right, the parasympathetic or sympathetic, is going to be really close to that value of 2.6, which is optimal. And so that's really where you want to be. That shows that we're in a more balanced state. Our glands are functioning well, right? We've got energy to be produced. We're not overproducing energy, which is causing fatigue, or underproducing energy, which is causing fatigue, right? And we're being stress resilient, right? We need stress resiliency when we have stress in our world every day, right? Not only from our external environment, but what could be inside, the toxic elements that we're exposed to every day, right? Toxins in our environment. We need stress resiliency to be able to make it through that with success.
Yeah, I was just trying to see. So trace elements, I'm actually moving into that one now, finally. I was just looking at the calcium phosphorus ratio. I just want people to see. So I'll just pull mine up here real quick so you guys can see. This is the retest that I did a few months ago, which I'm actually going to redo again. But we see down here, the calcium phosphorus ratio is all the way at the bottom and it's at 8.67, but prior it was actually at 12. So it's actually coming down. So you want to be as close to 2.5 as possible. But now this one is saying mixed oxidizer because in this test, there's actually, can you explain why sometimes when the calcium phosphorus ratio is still saying slow, why it says mixed?
Oh, absolutely. Because so we talked about two ratios, thyroid and adrenals. So now let's look at them. This is perfect when we have a visual. So when we talk about the thyroid, what ratio represents that? Calcium to potassium. So on the test here, you're looking at Ca to K, Okay. That CA to K should be at 4.0. That's ideal. In this particular case, it's at 10. So it's a bit above. We have a little bit more calcium presentation than potassium, which means we have a bit of sluggish thyroid expression.
Right.
Now, because it's mixed, remember how I said mixed, there's going to be an underactivity and overactivity. If we look at the sodium to magnesium, which is the Na to Mg here, 4.17 is the ideal ratio. You're at 5.67, so just a bit above that, which means we've got a little slight overactivity in the adrenals, which is why we're in mixed oxidation.
I see. Okay. And then the last time I had was a little bit closer. So it was actually my adrenals actually were.
Yeah, your adrenals have always been balanced. I mean, 4 to 4.17, you're just barely sluggish. I wouldn't even call them sluggish. That's like a balanced adrenals.
Yeah.
And then your calcium to potassium was a little bit higher that time, 18.63.
Interesting.
So that's getting better too.
Getting better. Yeah. Okay. Okay. So that's what, when she's talking about the ratios, it's these ones down here. And this is ARL. So now moving forward, I am actually moving to trace elements, but it's the same idea, the same philosophy.
Exactly. And the significant ratios, I mean, there's 7 ratios. There's 6 here. There's one more ratio that you'll find on trace elements. And ultimately you can do it here just by hand. And so the interesting thing is, so let's go down the list of what we see here, because now we've talked about 3, right? The importance of where is the body? Are we in parasympathetic or sympathetic dominance? That's important for us as clinicians to know about our clients, right? Then we have the calcium to potassium, which we talked about, thyroid. The sodium to magnesium, which is adrenal, right, relation. Now we have basically 4 left. So let's start at the top here. We've got Ca to Mg. That's your calcium to magnesium ratio. That's representation of blood sugar. So how is our body handling blood sugar regulation? And so calcium and magnesium are both very important. Calcium supports the excretion of insulin, and magnesium is important for glucose regulation. So those being in balance really help with regards to the food that we're eating and how that's utilized and balanced. Then when we go down the list, I want to skip sodium to potassium for now, but we'll go to zinc to copper. So Zn to Cu. Zinc to copper is our hormone ratio. So many times we'll see it elevated when we have progesterone dominance in women or testosterone dominance in men. The other thing, which we're going to touch on today, I think, is when we have what we call hidden or biounavailable copper buildup. That can also be high because now we're causing oxidative stress. And so that ratio is really important, as it is one of the markers for us to do a copper assessment. Now let's go back to the sodium to potassium. The sodium to potassium for us as practitioners, as physicians, as clinicians, is the most important ratio. What does it tell us? It tells us, Na to K, it tells us about the stress the individual is under. And why is this so important? Well, first off, sometimes we as individuals, we all handle stress differently, right? So you could have one person with a to-do list and another person with the exact same to-do list. And the first person is not stressed at all. And the second person has severe anxiety from that to-do list. So this ratio is important for us, for those people that have a to-do list that long but don't feel stressed, because their body may be stressed and they're just either not listening or they're immune to it, right? So that gives us a really intricate part of them and the stress that they're under. And so this ratio has a few meanings to it as well, which is really interesting. So first off, yes, it's known as the stress ratio. So Dr. Hans Selye years ago came up with the general adaptation syndrome theory. And so he was the father of stress theory. So if that ratio is really high, that means we're in an acute alarm stage of stress. If it's in the middle, we have to do a little assessment, because either we're in stress resiliency, which is a good place to be, or we're being resistant to stress as we move into chronic exhaustion, right? As it's low, that's when the exhaustion kicks in. And that's when the adrenals are really insufficient. And then the other part of that is it's called the vitality ratio. So we want to have the sodium to potassium in balance. That is the most important ratio for assessment, because it tells us about the vitality in the body.
Yeah. And I'm curious, like if we go back and forth, sodium potassium was 4.5. Yep. And now it's gone, looks like, I think I'm looking at the right. No, wait, I'm not looking at the right one here. I'm looking, here we go.
4. Yeah.
Where am I here? Okay, 4.
3.9. So you've always been in about 4.5, 4, 3. You've always been kind of in, and interesting too. Can you go back to the first one? I just want to point
Sure.
something out, which is really
Yep.
interesting.
Let me actually make sure I have both of these. Okay. Yep. First one is there.
Perfect. Okay. So yours is great because you always have a really healthy sodium level. In either, and this one's a slow oxidizer. I mean, that's, it is what it is because your adrenals are a little bit tiny bit low. I wouldn't even say it was a slow oxidizer. But sodium in this day and age, it's almost uncommon to see it at that level. Usually, in many cases nowadays, we have so many people in chronic stress. So the sodium is single digits. Mm-hmm. Right. And that tells us that we don't have the energy. I have gone through a really low sodium. I was using a specific protocol. The detox was a bit too much for me and my sodium dropped off and I didn't feel like myself anymore. I was tired. I was depressed. It was really hard days. And so I thought, something's got to change here. My body doesn't like something that I'm doing. I need to back off. And I literally remember the day and where I was when the sodium changed. And all of a sudden I was like, I'm driving down the road and I was like, wow, I feel really good today. Like something's changed. And I got to the office and I took my hair sample and my sodium was back up to 30. And I was like, oh my goodness, it went from 4 to 30. And I was like, wow. I'm like, that was it. I knew something had changed.
Adrenals, yeah.
That's how much it can affect you. Mm-hmm. It's incredible. Yeah.
Yeah. So, and the reason I'm going back and forth with everyone is because this is like 3 years ago. I know it's a long time, but I was taking the Vykon more regularly now because once I saw this, I was like, oh yeah, I need to be made a little bit more better with it. So I'm definitely consistent now. At this point, I was a little inconsistent, but I'm more consistent because I saw the improvements and I see the improvements in my health overall. Plus my immune system is functioning better. I'm not getting the chronic UTIs that everyone's notoriously getting, no infections. I'm not getting sick anymore. Knock on wood. I'm hardly getting sick, and so even though there's a lot of work that still needs to happen here, we have seen really good shifts happening.
But your body's doing it. So you look at the mercury, you've got a little cadmium there, some aluminum. Okay, that's fine. A copper looks more or less normal, right? But now let's go. We had copper here, right? Copper was affecting you here. And so as soon as we have copper that's elevated, there could be a couple things. I mean, we could have copper exposure. I mean, that can come from many different sources.
You see the ratio is actually low here.
Mm-hmm. Yeah, exactly.
I could have had actually true toxicity.
Exactly. And again, it's not that high. I mean, the highest copper I've seen to date is 61. That's a true toxicity.
Oh, wow.
Right? And so, so when
this is elevated copper here.
Yep. Yeah. So when we have elevated copper, is it biounavailable? It could be. And so that contributes because copper is an antimicrobial, an antifungal, an anti-mold.
I've had fungal issues forever.
Exactly. So if we don't have enough bioavailable copper, hence we go down this road and open the floodgates. And that's why we have chronic bacteria and yeast issues.
That's amazing. And that honestly does really correlate to a lot of my symptoms as I describe when I see the copper toxicity. So, so we went through the ratios here. Is there any other ratio here that, I know the copper one's a big one and we're going to dive into copper toxicity in a minute here. Mm-hmm. The other one I was going to mention, I see a lot is this blood sugar ratio, which I find is very much associated with a lot of the symptoms of this reactive hypoglycemia. Actually, back here 3 years ago, I did have some hypoglycemic symptoms, although it was getting better because I was doing, I was just training my body to be more ketogenic. But at that time, I didn't know I didn't know what was going on. And I noticed like if I didn't eat within a certain time period, I would pass out.
Yep. Instant, right? Yeah,
and I see that rampant.
The fluctuation. And honestly, I mean, you can see this ratio, the calcium to magnesium ratio, even reflective when I look at different cultures, because we work with people all over the world. And there are some cultures where, because they're consuming a different type of nutrition, right? And a high cal mag ratio can come back around to carbohydrate, right? Carbohydrate, either overconsumption or intolerance, right? Breaking it down.
Yeah.
And
I see that sometimes too, intolerance. Yeah.
And we've seen them in the 80s. Where the ratio is in the 80s.
Oh, the 80s. Okay.
Yeah.
Okay. Oh, wow. That high.
That
Oh, wow,
high.
that high. Okay. So what are those people? What are their symptoms?
Well, major they and normally there's really high calcium involved there. So sometimes we see calcium in the 800s or 900s as well.
No way. And that's
Yeah.
something else that I think we should just briefly touch on the calcium because a
Yeah.
lot of people are asking me, what is a calcium
What
shell?
does it mean?
And
What does it
because I
mean?
wasn't really in a shell yet here
No.
by the standards of the definition. Isn't an over 170 considered a
Yeah.
shell?
Yeah, exactly. Yeah.
Yeah, so here I was at 149, and here now I'm coming down. So it's coming down, and that's the whole idea behind mineral balancing is these high bioavailable values start to come down. They start to go where they're supposed to go in the bone and the teeth.
Exactly.
So yeah, let's
Exactly.
explain quickly a calcium shell.
Yeah, so I mean, a calcium shell again is identified on the test when it gets to 170 milligram percent or higher. And the severity of that, again, if it reaches what we're seeing now, the 3, the 4, the 5, 600, even 800, I think is the highest we've seen.
Oh my goodness.
That's severe. And so remember when I talked about the calcium to phosphorus ratio, that rest and digest where the metabolism starts to kind of slow down because calcium, when you think about a stream running through rock and you see calcifications, that white kind of heavy sediment on the side of a rock, that's what's happening in your body.
That's crazy.
It's a heavy kind of sedentary feeling, but when it's in the tissue, rather soft tissue and the organs rather than in the bones and the teeth, it's also causing severe oxidative stress. So now you're inflamed, you could have osteoporosis, osteoarthritis, all these things because the calcium isn't getting into the bones and the teeth to refill the reservoirs and keep them up the way that it actually should be. And so, I mean, the amount of symptoms associated with calcium shell, the first part of it is that calcium shell kind of gives you, it like puts a veil over you, right? It's almost like you're detached from reality. You've got a little social withdrawal. You just kind of feel heavy and sluggish, right? The metabolism is slowing down. You probably have weight gain or the inability to lose weight.
Yeah,
Again,
that's part of everything that's described with me. Yeah.
yeah. And I know when I actually ended up moving calcium, but as I did that, my calcium increased with the therapy that I did years ago. It went up to 185.
Oh.
And I felt the effects of that. Because when I went to the gym, I mean, the first thing I do when I go to the gym before I start training is I roll up my back on a roller. And when my calcium went up, I knew something was wrong. I didn't know that it had gone up that high, but I know that when I started rolling on a roller, my back was actually in so much pain that I couldn't even do it. And I was like, what is happening to me? There is something that's changed. What is it? And yeah, my calcium shot up from under 100. I think it was at 68 to 185.
What do you think was causing the back pain? Can you explain the physiology behind what was happening, probably?
Yeah. And so one of the main symptoms that seems to come out of calcium is we can get calcification in joints, right? So one of the things that I found, I had a client a few years back, she's still a client, but I started treating her about 3-4 years ago. She had osteoporosis and she was supplementing with high doses of calcium. When she came to me, everything was just she couldn't even make a fist anymore because her joints had so much calcification. So it's kind of the same. When it starts to build in the soft tissue, it's going to go into the joints. It's going to combine. It's going to encompass the spine. And so it just causes friction and immobility until it starts to be ionized again and starts moving so that you can metabolize it and precipitate it. And that process itself, I mean, it takes time.
Yeah.
If you have someone who, like this particular individual, she was supplementing with high doses of calcium. So I was able to change the pattern over the course of like 9 months because we took the supplementation out and started using cofactors to get that calcium where it actually should have been going, right? She had enough in her body.
The test. She wouldn't have known that had she not done the HTMA.
100%. So I mean,
she would have kept
now
pounding down the calcium because that's what they tell. Was she over 50?
Yep.
And that was what they would tell you to do to
of course.
osteoporosis.
It's yeah, exactly. And so she got to a point, she's like, I have to make a decision. Either I keep doing what I'm doing, which is literally, she was having a bowel movement like once a week. I was like, oh my gosh.
Wow.
I'm like, you can't do that. You have to eliminate every day. Can you imagine the toxins that are sitting in your body when you're only eliminating once a week? So she was literally calcifying from the inside out because her body wasn't using.
Well, do the arteries get calcified? Because I have a patient who actually has a similar pattern, not like a 300 or anything like that, but definitely calcium shell pattern. And she had told me prior that she definitely had some. It was actually a they called it a aortic aortic
Okay.
aneurysm,
Hmm.
which when I looked it up definitely involves calcium.
Calcium. Yeah. Calcification.
And that can
It's the
happen at that
same.
level. You hear that? So everyone's listening. It's not just about the bladder.
That's
It
right.
can affect, it can literally can kill you.
There's, the way that I describe minerals just in general, it's when you build a home, in most cases, where I live, anyways, we start with the basement, the foundation of
Right.
the home, right? And so that foundation has to be strong. If it has cracks and, cinder blocks that are broken and your mortar's coming out, you're going to have problems. You're going to have water, you're going to have rodents, you're going to have all these things that are now going to weaken the state of your home, right? Minerals are that to us. They are our foundation. And if there's imbalances, that's going to create the cracks and allow all these things to be able to come to fruition, which ends up causing conditions and potentially, disease.
I'm so glad that you're saying this because that's exactly what I tell the patients when we do the HTMA as the first test. I always tell them that's the first one you're going to send in. That's the first one we're going to review. We don't do any interventions, minus a few gut stuff. I'll get them started on gut work. But the Vykon is absolutely the first thing they do before we build on anything else. And I generally want them on it and we'll talk about iodine in just a minute, but I generally want them on it for about 6 to 8 weeks before we even consider iodine or anything like that, because I want the cofactors to be doing the work, because I say to them exactly what you said. The interventions we're going to do later are not going to work right until you have the foundation. We have to build a foundation, and that's how you're going to get that shorter timeline of healing. Otherwise, if we do it in a wonky fashion, you're going to be feeling like a hamster on a wheel, spinning and spinning and spinning. And it's kind of like building a house in a very disorganized manner. And you're just doing a little bit here, a little bit there, a little bit here. But if you do the foundation first, you can build from that, and you're going to have a much beautiful home built, ready to go, ready to move in much quicker. So I'm glad you mentioned that. That's what I always tell people. So the copper toxicity is the next piece I want to kind of touch on, because I see this rampant. Generally, I see it with patients who've been on birth control for extended period of time, 5 years, 10 years. You'd be surprised. There's actually girls on there who I work with who've been on birth control for 20 plus years.
I know. Well, and it doesn't take all that long to build up. So, there's so many sources for copper, right? It can be birth control, IUDs, xenoestrogens, phytoestrogens, all these stress, right? There's so many faucets for that to be able to happen. And so, but what happens in the grand scheme of things is, and I've seen it happen in young women who they're now choosing a copper IUD because it's a non-hormonal choice that's being given, right, here in Canada for the last few years anyways. And the detriment to their health happens so much faster and in such a shorter period of time of exposure. It's absolutely astronomical. And so it's been a bit of an uphill battle. But what happens in the body? So we get exposed to, let's say we're taking birth control, right? We have estrogen in that, so we're getting exposed to something constantly.
May I interrupt? Does this also include hormone replacement?
Yep.
The bioidentical hormone replacement postmenopausal.
Yeah.
Okay, so that's just to make sure that
I'll touch on that in a minute too, because I want to give you a little story, just a quick one about something that I've done, because I'm kind of in perimenopause right now. Well, I think I have been for a couple of years, but I'll touch on that because I just had a conversation yesterday about a woman who's pretty much my age, and she had asked me about that, and I wanted to give her my opinion, so I'll touch on that. But what happens with the exposure, and again, HRT, same thing, is your body gets exposed. If we're in good health, right? Our adrenals are functioning well, we've got mineral stores that are sufficient, right? Because when we're exposed to that, what's going to happen is our body's going to start sequestering copper when we can't metabolize all of it, because estrogen and copper are very succinctly related in the body. And so if we have strong adrenal function, that's going to mean we have strong ceruloplasmin, which is the protein that transports about 95% of copper throughout the body and obviously metabolizes it too. And then what happens is we have a cascade of events in minerals that go. So the first one to be affected is zinc. So we start off, we have sufficient zinc stores. Copper comes into the picture. Again, may take some time. Maybe it's a year, 2 years, maybe it's 4, maybe it's a month. Everybody's different. We have a decrease in zinc because now we have more copper. So now we're creating an imbalance, right? All of a sudden the hormones are imbalanced. Then what that does is it ends up, copper loves to deplete potassium. It loves to deplete potassium out of the cell, which ends up in the blood and then gets excreted from the kidneys. When that happens, remember we talked about the sodium to potassium ratio and how important that is, right? The vitality ratio, the stress ratio. So as soon as potassium drops off, guess what? That sodium to potassium ratio goes up. Now the body's in an alarm stage of stress. That causes magnesium to be burned. The relationship to magnesium is that it keeps calcium in check to a certain extent. So if magnesium starts to deplete, guess what's allowed to rise in the soft tissues? Calcium, right? So copper toxicity or imbalance can be a driver for calcium shell. Right?
Okay,
So it's a
sense.
cascade of events down. And so what we have to do is we have to kind of bring that all back into perspective to be able to fix the problem, right? We've got to give the body the adrenal support that it needs to be able to support the liver's production of CP so that we can get copper transported again, because we need bioavailable copper, but we also need it mobilized, right? We need to start some of that metabolism of copper to be able to bring it back into balance. So there's just some factors all involved in that with the buildup, and then what you have to do to be able to bring it back into balance and then solve some of the other problems that are that cascade.
Okay. So what did you want to say about your story about the hormones?
So hormones. So, okay, we're in our 50s, right? You get into 50s, even late 40s, and hormone replacement sometimes. And I don't want to say never, because that's not fair. Everybody's different. And I think there are therapies at different points in time which can benefit people. So I am very open to all of that. But we have to remember that if we're, so what did I say about trace elements and slow oxidizers? 80%. So if we have a slow oxidizer whose adrenals are already stressed, who is in some stage of stress, whether acute or chronic, right? Either one, and adrenal insufficiency, and we put hormone replacement into the picture that includes estrogen, what's going to happen? We're going to end up with a copper imbalance, which is going to drive the adrenals even further. And then a woman coming back later saying, I don't know what's wrong with me. I'm so tired, I can't even function. Right? Because we're just taxing that system, because copper
and I
is
hear this a lot. They'll feel great in the beginning of treatment and they're like, oh, this is the answer to my prayers.
Yep.
And then you know, a year later, maybe even sooner, they're like, I don't know, it's not working anymore.
Yeah. So what I did, because in 2 years ago, exactly 2 years ago, I started having all kinds of menopausal symptoms, right? The hot flashes, I couldn't sleep, and I was just everything. It was within a month, and I was like, what is happening to me? And then I was like, oh, okay, I know what's happening. So I ended up in my formula, because of course I've been mineral balancing for years, I increased my boron.
Yeah.
Within a month, it fixed all of my issues, and they've never come back. So again, I'm not saying for everyone to go run out and buy boron.
What do you think boron did for you?
I think that it just has had a balancing effect on my hormones. I think that's what it did. And I think at the time, you know, I may have been going through a bit of an estrogen dip, and it just brought things back into a type of balance, because of, again, I've kind of stuck with that dose. I'll probably go down and try that, just because I always want to make sure that I'm not taking too much. Right? Too much isn't always better. Right. But I think that we have to do that for a period of time sometimes to make the correction. But I think I've crossed that bridge. So.
That's very promising. That's another reason why I switched over to trace elements, because I want to be able to see the boron levels.
So important to see that level. And you know what? I've used this with many different women kind of around my age, and have had similar effects. So I think there is a lot to be said when we're struggling with changes of life where minerals can help, because what happens in our changes of life is our minerals start shifting, right? We have to remember that minerals are dynamic. Patterns change. We can change patterns even with lifestyle changes, nutrition, exercise, better sleep, a little bit of supplementation, like all those things can start to make changes in your mineral patterns.
Very nice. So, okay. So that was a bit on copper. Next one, iodine. Wow. I mean, that was eye-opening too, because there was a doctor years ago, oh gosh, I'll have to look it up. He actually treated UTIs with potassium iodide. And so that 100%. Was the first time I was brought to light on the benefits of iodine and realizing that my deficiency was hurting my bladder. And I did have a deficiency. I've had subclinical hypothyroidism, let's put it that way,
Yeah.
for probably 15 years or maybe even
Mhm.
longer, meaning that it wasn't high enough to be diagnosed. I had all the symptoms of it,
Mhm.
but my numbers were always borderline to the point where they couldn't diagnose me. They didn't necessarily recommend treating it with medication, but I had all the symptoms.
Got
So
it.
then looking back, I realized that iodine was the big deal. And just trying to look up his name here, what his name was, the iodine. I don't remember what it was, but he actually treated it with potassium iodine. So yeah, let's get into that. So what is exactly going on? Why are we seeing a rampant amount of iodine deficiency in this country?
Well, so I think that right now, so when we think about iodine sufficiency, what do people think about? They think about iodized salt, right?
Yeah,
And let's be honest, iodized salt
I
probably
found his name.
has,
Sorry, Dr. Wright.
oh,
That's his name.
oh, okay,
Are you
yeah,
familiar with
definitely.
him?
Yeah,
SSKI.
yeah. I've definitely done more study with like readings of Dr. Brownstein, Lynn Farrow, and I have some books I'll show if anybody wants to read, but very similar. So okay, let's put salt on the shelf just for a sec, because I think there's an important factor, because there's a lot of iodines out there. Okay. And so back in 1829, Dr. Lugol, who created Lugel's iodine,
Mhm.
right, which is a mix of 5% iodine, 15% potassium iodide, and 85% distilled water, right? This is the formulation that I use, that I've been taught to use, right? But there's a lot of other iodines out there. So there's iodine, where it's just iodine, and now the kind of health marketing is, well, it's better absorbed. But if you do any of the historical readings back in 1829, one of the reasons why Dr. Lugol put the potassium iodide in was because he figured out that it made iodine absorption better. The solubility was better, so it was easily absorbed versus just iodine. So I just want to throw that out there for people to just think about when, if they are going down this road and they're, just for education purposes. So now iodized salt, right? We're like, well, first off, some people are anti-salt completely, right? Because of iodized salt. And so they're not going to be getting that type of exposure for iodine. And I mean, ultimately, when you think about the minuscule amount of iodine that's put in iodized salt, and then if iodine oxidizes, right? So if you put a salt shaker on the table that's exposed to the air, by the time you even use it, chances are most of the iodine that's been in there has oxidized itself away and there's nothing left anyways, right? And then we look at the fact of like, what about, we have so many toxins in our environment that are displacing iodine, right? And that are causing deficiencies, even if we have a sufficient source. And that's going to come back to halides, right? Chloride, bromide, fluoride is one of the worst ones, right? Great for our teeth, not for our thyroid. And then the other one that's come up in the last 30 years, and this is Dr. Brownstein says, he believes that this is one of the main drivers of iodine deficiency and why we're seeing it so much more these days, is perchlorates, right? So our exposure to all of those kind of environment in the contaminated water. Yeah. And so, exposure to these things is driving iodine deficiency. And then put on top of that we're not getting enough sources of iodine.
Oh yeah.
Right. So exactly, right? Yeah. We're not eating seaweed enough. We're not kelp. Yeah. And I mean, contamination, right? People worried about mercury, rightfully so. And, but I mean, people in Japan are taking it anywhere from 6.25 milligrams to say 45 milligrams a day, which again, that's a bit excessive, but that's what they get. And our RDA in the US is 150 micrograms. We're not even in the ballpark, right?
Yeah. So you guys shouldn't undo the math. That's 0.15 milligrams.
Yeah.
That's nothing.
Exactly.
Yeah.
So I think that there's a few things at play when we're talking about iodine deficiency. And I mean, and then you get into, what does it do? Well, thyroid issues, right? We could have Hashimoto's, Graves. We could have nodules. Nodules are just basically cysts, and iodine deficiency is one of the biggest drivers. If someone has a cyst, I know instantly they're iodine deficient, because that's one of the symptoms of deficiency, right?
Any cyst or just in the thyroid?
No, any cyst. I actually had
ovarian cyst.
I actually have a cyst. It's I feel like it's a permanent structure on me, but I'll tell you, back in 2020, early 2020, 2019, I started using higher doses of iodine at the end of the year. And I had a tiny little cyst on my back, right near my shoulder blade. And it blew up to the size of a golf ball when I started ingesting high doses of iodine. And I was like, wait a second, okay. And then, so I said I went to my doctor. I'm like, what is this cyst? Okay, it needs to be surgically removed. I'm like, okay, I'm not doing that. So I literally started painting iodine on it every day. And within 6 weeks, it was gone.
Wow.
And now it's interesting now because I took a little bit of time off iodine because my iodine sufficiency had been good. So I took a little bit of time off. And then come into 2022, it was back. And I was like, wait a second. So test my iodine again, do my markers. And I'm like, I need iodine again. So it's like that cyst for me, and that however the mechanism, whatever it's happening, it told me. But the fact that it took that cyst from that size and completely dissipated it, like the way that it happened, I wish I would have documented it throughout those 6 weeks. I didn't, but I wish I would have, because it was quite an incredible situation.
So with iodine, I did realize that sometimes the TSH jumps up, and that scares my patients when that happens. So can we explain to them that it's just a temporary thing?
It's normal. So think about this. You've got a group of people. Let's say you have a downtown that's kind of desolate. Downtown was busy, and now all of a sudden there's nobody there. So you're really not going to have any taxis down there because nobody's there for them to pick up, right? So they're going to be like, meh. But then all of a sudden an influx comes into downtown. Well, we need taxis. Okay. So think about if you have a body that's iodine deficient, there's a transporter that is needed to transport iodine as it diffuses into the thyroid follicular cell, right? Which is called a sodium iodide symporter, or co-transporter. And so that's like the taxi for iodine. So if we ingest iodine, we need more sodium iodide symporters to get the iodine into the thyroid cell, right? And so it's kind of like the taxis. So the driver of those taxis, the caller, the central agency that's calling all the taxis to go downtown to pick these people up, is TSH, right? So the TSH, if it goes up, that means your body's responding to the iodine, and it's bringing more symporters into the system to be able to shuttle the iodine into the thyroid follicular cell. So it's temporary. It should be temporary. And that's where you have to, monitoring blood work's important. Exactly. And we need to make sure that if it goes up, that it's a temporary kind of, should be less than around 6 months or less, that it should be elevated. And then it should come back down to normal.
Well, this question comes up as well. Someone has thyroid antibodies, and I know there's mixed belief out there. Is it safe to take iodine, or would it be better to wait until the antibodies are non-detectable to start iodine?
Okay, so this was definitely a learning curve for me in the last 5 years. So I have learned through a mentor that specializes in this, that there's a couple of things to look at when we're talking about antibodies. So first off, if we have thyroglobulin antibodies that are elevated, it's not an oxidation phase that kind of constitutes those antibodies. It's not what they do. So you can use iodine with regards to those, fine. Now, when we talk about thyroglobulin antibodies, what we have to do though is if they are elevated, especially severely elevated, we have to look at phase 2 liver function and support that, right, with the nutrients that needs. Now let's go backwards a little bit. So now we're talking about thyroid peroxidase antibodies. So thyroid peroxidase antibodies, that's an oxidation phase that happens, right? And iodine is oxidizing. So we have to be careful if the thyroid peroxidase antibodies are elevated, because if we put too much iodine into the mix, it could cause that oxidation to cause more stress, right? So you have to be careful of the level of iodine and make sure it's not too high when you have elevated thyroid peroxidase antibodies. Now, the other part of that is if you've got elevated thyroid peroxidase antibodies, you've got to look at phase 1 liver function and fix that, right? Get the nutrients involved to make sure, because if we have, I was taught that if you look at the thyroid in your phase 1, phase 2, TPO, TGB, it gives you a direct reflection of what's happening in the liver. So whatever's elevated, fix the phase of the liver that's reflective of.
Good. All right. Good advice. All right. And then now that we kind of dove into all the different pieces and the elements, talk about Vykon, and, you give a little history on how you started it, what drove you to want to do this, and why it's so unique. I mean, my patients love it. I love it. I mean, it's just something that we're going to stick with. And then I do get this question as well. As I throw this in. Do I have to take this forever? Oh my gosh, I get this question so many times.
I'm going to, because I just want to be as healthy as possible.
And then I have to have the over 40 conversation, and I know people don't like when I tell them that, but I'm like, you're
oh my
over
God.
40.
Well, and I mean, like,
I hate saying it, but it's the truth. I mean, we're getting older.
I'm going to be 50 this year. So, and I'm like, I'm always going to take supplements of some kind. So why wouldn't I, right? Yeah. I mean, we have to consider the fact that we're not going to be getting the nutrients from our food. We're going to get nutrients, but not like we used to, not like 50 or 100 years ago. It's not the same anymore, right? We have a lot more things to face, and our body has so much more to deal with so many toxins in the environment that we're in every day, right?
And
no matter how,
and the stressors,
and the stress. You got your phone, you got this, you got work. Yeah. Like, we're on the go all the time.
Yeah.
Right.
And biochemical stress too, with the, mold toxicity and pesticides and yeah.
Glyphosate.
But I still get those questions. They come up. And so that's the, why do I take Vykon and why will I? And I said to them, and as long as Lisa's still in business, and if she's not, I'll just buy it out then at that point.
Well, and for me, I spent years doing hefty right? You get your protocol. I remember one protocol I got, it was 2 pages long, and I was like, oh my God. And I'm like, I'm doing it. It's okay. Like, I've got my box of supplements in my closet, and I'm going to put them all in my things every day.
Choking on them and everything. Oh God.
Right. And it's just like, and so what really got me though was I moved into a clinic at one point. I think it was back in 2017. And that's when I was really bringing HTMA into practice, was like 2016, 2017. And I remember when I first started, because there's a lot of intricate pieces to mineral balance, right? You want to use the minerals, but you want to use synergists, and sometimes you got amino acids on board. And so I'm making protocols, and there could be 20 or 25 things on it. And I'm like, oh, wait a sec. And I haven't even done a probiotic or nothing else, right? And so I remember even kind of breaking it down to the simplest things, saying, okay, well, I could take that out, and I could take that out. I think that will still get me the results I want, right? And it's like, here's your $650 or $700 worth of supplements. It might last you a couple months, and I'll see you then or whatever. And clients were just overwhelmed. They're like, I can't do this.
And they can't choke it all down either.
No, it's too stressful. They already have a stressful life, right? Yeah. So now they're trying to take all these supplements and organize themselves. And it was just, it was causing them more stress.
Yeah.
And so I sat back one day and I was like, there has to be something better than this. There has to be. And for me too, because I was getting tired of taking all this stuff, right?
Oh, yeah.
And so that's really where this came from. And I happened to meet somebody that was, lab oriented. And I was just like, we're going to do this. This is what we're going to do. This is what I want to do. I'm like, I know that we can make a difference. And so, and here we are in year 4.
Yeah, we love it. And, I'm glad that you mentioned that consolidation, because sometimes I get it's so expensive, and I'm like, let's just sit down and calculate every single item in here, and I will promise you, when we finally add it all up, not only are you going to be paying 3 times more, but you're going to be choking down a ton of pills, and you're going to hate your life. Whereas this is so easy. I just kind of put 2 scoops, and I did find something with the naked shake, the naked one. It tastes pretty good, just mixed alone with flax milk and manuka honey.
Oh, nice.
Yeah, and I'll throw a little curcumin in there, like liposomal curcumin. Yeah.
Perfect.
Yeah. It just doesn't even need to be in a protein shake. Yeah. It can actually be consumed in that manner by itself.
This is mine. Like, I literally have a little 9-ounce mason jar. That's my vitamins for afternoon today. I throw some water in, and away I go. That's me.
Yeah. I mean, listen, like, the conversation has to also be like, when people complain about the taste, I have to say, well, Well, you could otherwise be injecting yourself with insulin every day. I mean, that's an option. I mean,
Right.
it's a reality check, right? I
Yeah,
mean,
yeah, yeah.
I think that you've done a very good job, I have to say, with the naked formula to make it as neutral as possible. And like I said, if you throw it in a shake with fruit and all those other stuff in it, you
Yeah,
don't
throw
really
it in
know.
a smoothie. Like I love doing just basic smoothies. So I throw in some cucumber, maybe a little pineapple or something like that, water, and then that's it, right? Throw it in there and
Why
there you go.
powder? Why did you decide? And I love the idea of powder, but what is your main rationale behind? Is it just ease of use?
Ease of use. I mean, you can do capsules, but I mean, even for my own powder, like I put a lot in my powder. I have collagen and all kinds of stuff in mine. And I think, I calculated out one day just for fun in the office to say, okay, if I made my powder into capsules, how many capsules would I have to take a day? And I think it was upwards of 55.
What?
Right. So, I
Oh,
mean, so
yeah.
I can drink this twice a day, or I
Yeah.
can take 55 capsules. I was like, I'll drink that. It's so much
Yeah.
easier.
So it's mainly for
Uh,
ease.
Totally ease of use. Yeah. And portability, right? And I also find, so my mom is 85 now. And so she's been on Vykon ever since I lost. She was one of my beta testers way back.
Oh, that's awesome.
And yeah, and I mean, she's been mineral balancing for years and, doing good. So, but for her, especially, is that, sometimes she'll call me and she'll be like, am I supposed to take two of the black gel things, or am I supposed to take one? Right? She's talking about astaxanthin, and then lutein, the orange ones. Am I supposed to take one of those or two? Right? So when you have this, and she just has to take a twice a day, she's not going to mix anything up. Right? You have to think about that. Like when you get into people who are older or whatever, like that can be hard for them managing different capsules and all kinds of stuff. So if you can have kind of everything in one thing where they just have to focus on one thing a couple times a day, it's so much easier. And for her, for me, it's safer, right? Because then she's not going to confuse things and take too much of something and not enough of something else.
Well, they also have the issue with swallowing with age as well.
Yeah.
Because
Yeah.
my mom does choke a lot more now that she's older, and there's definitely something going on with the esophagus, the muscles. I think with maybe probably due to estrogen or hormones. Speaking of that, what's in the pipeline as far as add-ins that you might want to be able to share to people who are listening?
Oh, well, we just updated our add-ons to include humic and fulvic acid,
Oh,
which I
nice.
love.
Yeah.
And also dandelion leaves for kidney support.
Oh,
And so, yeah, so
in the powder, just kind of put it. Okay.
Yep.
All right.
And so, yeah, so we've been beta testing these. We've had beta trials going with horses for the last 3 years. And so I was really curious because a lot of people make claims about humic and fulvic not binding to minerals and what have you. And so I really wanted to dig into how it supports the absorption and balancing of minerals. And I think it really does. I think it really does a lot, because when we had our horse trials, and as we continue, the horses all dropped into really balanced patterns when I added the humic and fulvic. And I'll tell you something, I really didn't add all that much. Horses on average are around 500 kilos, and I was putting in doses around what we take, right around 200 to 350 milligrams. It wasn't much. You don't need much. If you have it, so our humic and fulvic is interesting too, just because it's from a Canadian humus deposit. And the reason that I like it is because they don't use chemical processing in order to get it to the end result. So they use chemicals in the very first step to be able to kill off pathogens, and then they use like a membrane throughout the rest to be able to filter down into a super concentrated powder. I have to do a video on this for you guys as practitioners, just because it's just such a beautiful, glistening, dark, rich chocolate color. The powder is it's a beautiful, beautiful powder. But yeah, you don't need much to do a lot.
It's in the base formula, or is that an add-in?
That's an add-in, yeah.
Okay. All right. Yeah. Ultimately, would somebody be able to make the Vykon into like their only supplement, where with all the vitamins too? Can that get something that
with the humic and fulvic? Yes, because that can operate as a binder. So if you don't have somebody with severe toxicity or environmental toxin exposure, if you don't have really high or mold or things like that, right? If you just have somebody who's kind of coming into a balanced pattern and they don't have a lot of other issues with regards to what it's showing from their testing or even on their HTMA, I think humic and fulvic right in the powder does good at binding and absorption. for minerals.
Okay, good. Yeah, because that's kind of, I'm trying to consolidate. And so that's, I think that's one of the things my patients want to hear is, can I take less supplements? And I found with a combination of yours and a few other things that might be something that we can do long term. All right, that's exciting. So anything else you like to share or discuss about?
Oh my goodness. I feel like we've shared a lot. I hope that people understand just a little bit more with regards to, and also obviously I'm happy when anybody finds HTMA testing, just because I've seen thousands and thousands of people have really amazing changes when they start off with minerals. And talking about being the first test, Mandy, is that's how I do it now too. My entire team. Yeah. This is the first test. Mm-hmm. We build on that foundation, right? And then we see, because I've actually found now too that, a lot of people will say, well, what about, other testing? And I'm like, I think we can wait. Like, let's do this first. Let's start a protocol and see what changes with symptoms. And many times the symptoms end up dissipating, and then some of that other testing isn't necessary.
Yeah, I don't do any fancy tests anymore. Like the real fancy ones, like stool testing is like the last thing now. It used to be the first thing. Now it's like the last thing. Dutch hormone. I'm like, no. If you're under 50, hormone testing, even over 50, I don't think it's necessary. I think you need, what are you going to do? Bioidentical hormones in 35? You know what I mean? So I like hormones will get better when your body reaches homeostasis. And that brings me to the last question, because I know I'm going to have practitioners that are watching this. Mm-hmm. Okay. You do require your practitioners are trained in HTMA before they sign up to Vykon, correct?
90% of them are. So if somebody, like we do have a couple of medical doctors on board with Vykon that aren't fully trained in HTMA. And what usually happens is they'll do consultations to review, or they'll join the membership. I know some of them are in there now, to learn more, right? Because because you have to know, diagnostic testing. We're talking about diagnostic testing. HTMA is probably one of the hardest ones to interpret.
It is,
because of those interrelationships. Yeah. It's really, I'm still learning. I've been doing this for a decade. Yeah. So it's like,
I find it the most complex test actually than all the
because there's so many intricate details. One's up. Well, why is this up? Oh, iron's up because of aluminum. Yeah. Oh, iron's up. So now manganese is up because they share the same pathway. Like there's just so many intricate details. It's really, and that's why it's one of the biggest tests to be misunderstood. Mm-hmm. Right?
Yeah, I think a lot of times people will look at it and say, oh, it's high, so just give, or oh, it's low, just give them more.
Oh, the best one, I had a practitioner contact me, this was a year ago or more. And she's like, I don't think I want to use HTMA because it doesn't match with my micronutrient testing. I'm like, okay, well, tell me a little bit more. What are you talking about? And she goes, well, they clearly have a zinc deficiency. It showed up on whatever micronutrient test she was doing. And she said, but the zinc on the HTMA test is high. Well, that makes no sense. Mm-hmm. Well, it makes sense to us, right? Yeah. I'm like, well, that's because she has a copper imbalance and the zinc is a lost pattern.
Lost, yeah.
Right? So you have to do some study. You've got to take a course. You've got to do a little bit, because understanding it's critical.
And your membership is, you might just touch on that real quick about your membership.
Yeah. So the membership, it's great. We get in there every week. We talk about case studies the first Wednesday of each month, because that's our case study day. We do a clinical workshop. That was actually your suggestion, and I think it's been good so far. So next week, we're going to talk about the different binders and kind of when to use those and how they all work. And we've done one on iodine. We've done one on copper. So just some of the more hotter topics that everybody's just, there's a little confusion around, right? And there's lots to talk about them. And so we just want to kind of bring some clarity, and we try and share as much as we can, right? With regards to articles, we're actually going to put an articles page with all of our,
nice.
So I read like
in your portal, in the portal, or in the Facebook. Okay. Portal. Okay.
In the portal. So, I read probably 5 to 10 research articles every day, right? Yeah. I'm always researching something. So I finally said to my IT, I'm like, I want to have a page on the website on the My Account page where we can have an articles tab. And then those articles, whatever I'm researching, split into either conditions or pregnancy or whatever I'm doing. I want to be able to put those there so that people that want to learn more and read more have an access to a portal that has all of this stuff organized. Because I think it's so, so critical. And sometimes, sometimes you can dig on Google for good articles, and some of them, I'm in with the University of Michigan State University. So sometimes I can get access to obviously ones that other people can't. So that's nice to be able to share those too. So that's definitely a benefit. So I'm excited about that. I'm excited to get that going.
Well, I teach at UWS, University of Western States.
Mm-hmm.
And so I have access to a lot of nutritionists over there as well. So
Nice.
I will definitely make sure to let them know
Yeah.
about,
Yeah. We'd love to be able to share
maybe
them
we can
and
do a
add them to the
webinar
database.
for this
Yeah.
college and have you talk about the HTMA, because I don't think a lot of them use it very often in their practice. So that's something that we can discuss. Well, this was really good and very informative. And I love your Facebook group, by the way, just those listening with the practitioners. If I'm not sure how to formulate something, I will put it up there and she will respond right away to help me formulate. So patients are listening. I am getting her guidance with your formulas too. So, because I'm getting better at it, but like it is, you have to do it a lot and see it a lot and really start to, it's honestly, it's a skill. It's a skill.
It took me a long time. I mean, I do probably 10 to 20 formulas every day.
Oh, wow.
Yeah. It gets, but you still have patterns, and I sit there and go, I don't know. Right. Because it's a bit of an art, and everybody is different.
Trial and
right.
error.
That everybody, it's an art, and depending on age and weight, and just there's a lot of thought that goes into each one. So I hope that group helps the people in it to be able to get a little bit better at that, because I know it can be a bit overwhelming in the beginning too.
Well, thank you so much. This was great. And so those of you listening, HTMA is where it's at.
Thank you for having me.